So this is a scoping review on pathways for integrated quality, environmental and health and safety management. And these are called nature-based solutions, and they are innovative, sustainable strategies capable of addressing the multifaceted environmental, social, and economic challenges.
There is no singular definition for a group medical visit or a shared medical appointment. They've been around since the 90s, and the idea of taking care of multiple patients at the same time in the same place has been around for decades before that. But here we are in 2026, and there is no one definition.
So when we feel safe and emotionally connected, we regulate stress more effectively, we try new behaviors and we take risks, we're more likely to persist through discomfort, and we're much more likely to shift identity and behavior.
So we ask, why is experiential learning a critical component of behavior change? And this is what I experienced, obviously, in my office counseling people. I thought that counseling them would do the trick, that if I gave them the information, they could go out and do it. But they couldn't, because it was difficult, because when they left my office, they went back into the same environment they came from. They were motivated, but they just didn't know how to take the first steps. So I went back to the Koch theory, experiential learning theory from 1984.
So this really just allows us to sit with our patients and really give them good education and knowledge. And it's also very good for the physician, because you have much more satisfaction knowing that you actually had the time to spend to educate your patient so that they can be successful.
Burnout in medicine is not a moral failure, and self-care is not selfish. Medical culture rewards self-sacrifice and pushing through, but body physiology doesn't respond to willpower.
As a physician, always important to lead by example, right? Remember that old PSA from the 80s, I learned it by watching you. So doctors who eat veggies lead to patients who eat veggies. Parents who eat veggies have kids who eat veggies. Yes, kids are naturally skeptical about food. It's an evolutionary defense. So when they see their caregivers eating certain foods, they learn, okay, I'm not gonna die if I eat this broccoli, right?
So again, kind of to sum up sports medicine, we need to know that sports medicine is lifestyle medicine. The connection is real, and we just have to notice it. Movement is medicine, right? Exercise is one of the most powerful tools to prevent and treat chronic disease. We need to be focusing on building strength, mobility, function across the lifespan.
The American College of Lifestyle Medicine is now currently running is working on an expert consensus statement, the panel of which I'm on, for best practices on shared medical appointments, which my hope is will be a advocacy tool as well.